morning, everyone. Woo, that was louder than I expected. Goodness. All right. Hi, I'm Garnet Stokes, president at UNM, and wow, I'm delighted to see the great crowd that's here today. I want to welcome you to this morning's meeting to explore and learn more about UNM's Grand Challenges Initiative. We have some members of our congressional delegation that I know are here or will be coming, and they are obviously, by being here, recognizing the importance of this work, and I want to thank them for sending representatives. Ken Lucero from the office of Senator Martin Heinrich is here. Thank you so much for joining us. And I understand Patrick Duran from the office of Congressman Ben Ray Lujan will be here at some point during our meeting. So really delighted that he's coming. I also want to acknowledge that one of our new regents, Rob Schwartz, has expressed his excitement about this whole enterprise, and he has joined us. I'm not sure where he is, but right in front of me, of course. Thank you. Thank you. So through a rigorous and expedient process, because we really did move this along, 3 research grand challenges have been selected from among 14 excellent and creative proposals that have been that really involve more than 160 faculty members, staff, and community partners. That's a lot of people. The process of developing these proposals brought people together to explore issues ranging from the extinction of species to education, to inequality and hunger, and actually many, many more. New collaborations formed around each of these great ideas, and these teams will be encouraged and supported to continue to pursue their research and scholarship in those 10 big ideas that you go to the website and you'll see that they're listed. I want to acknowledge and state my appreciation for the Grand Challenges Steering Committee that thoughtfully considered all of the proposal reviews and provided me with carefully reasoned recommendations for which proposals should be selected as the grand challenges we will pursue. I can tell you that this selection was not an easy task. We have some great things going on here at UNM. The 3 grand challenges you'll hear about today encourage all of us to think outside the box, to arrive at solutions to very complex, very difficult problems. While each challenge, a team of researchers and educators, there are a lot involved, but one faculty member served as a lead convener to bring together the team and to serve as a main point of contact in the initial stages of this process. So the UNM Grand Challenges are sustainable water resources, and there the lead convener is Carrie Howe, professor of civil construction and environmental engineering. The second Grand Challenge, successful aging. The lead convener is Dr. Janice Knofel, professor of internal medicine. And the last of the 3 grand challenges, substance use disorders. And in this case, we have 2 co-conveners because this grand challenge was formed from 2 proposals, one from Health Sciences and one from Main Campus. So they decided to work together, which I'm thrilled about. We're really pursuing that cross-LOMAS collaborations, and so this is really important. Katie Witkowitz, the Regents Professor in the Department of Psychology, and Brandy Fink, Assistant Professor in the Department of Psychiatry and Behavioral Sciences, will be working on substance use disorders. Each challenge involves a large interdisciplinary team of faculty and will, as they move forward, engage faculty, other faculty, students, staff, and community members. One of the purposes of our gathering this morning is to invite all members of our community, both on campus and beyond, to learn about and engage with each of these efforts. It's only by working together that we can truly realize the ambitious goals each challenge has put forward that will lead to a better New Mexico. While another commitment keeps me from staying this morning, and it's also keeping Chancellor Paul Roth from being here, and he sends his regrets to all of you, I am looking forward to seeing the video that our communications team is recording, as well as hearing more from each team as they put their plans into action over the coming months. The University for New Mexico will be working with communities across the state to make a healthy, sustainable, vibrant New Mexico. Thank you.
Good morning, all. I don't have an awful lot to add from what President Stokes just said. It's great to be here with you all. I want to just say a couple words about inflection points. Notion of inflection points in mathematics and science. Things are trending in one direction on a graph and change direction and shift into a new future. And I just want to suggest that we at UNM are at a real potential inflection point in our whole trajectory of who we are and where we're going. I don't want to downplay the political headwinds we face right now, the fiscal realities we continue to face. It may be another hard fiscal year. But I also want to emphasize the way that we have resources, we have incredible faculty, staff, and students. We've got some big We also have a great new president. We have 5 new regents. Thank you, Rob Schwartz, for being among those who've been willing to take on that service. We've got resources in this university that we can prioritize. It doesn't have to be a constant story of constantly trimming down. We're going to have to make some choices to prioritize some things over others. And we're going to pull in new resources from the federal government, from the foundations, hopefully from state government, to help fund these grand challenges. I think we're at that kind of inflection point, building ourselves into a different future than these last 10 years of internal tensions and some struggles to figure out how to adapt to the budget cuts that have been coming from the state. The grand challenges are part of the carriers for that new direction. Let's build some intellectual passion around this. Let's build some passion for New Mexico and the service we all give to this state. Let's solve the problems of water sustainability. Let's create a different kind of successful aging, healthy aging for a population that needs it. And by God, let's solve the question of addiction to opioids, to alcohol, to other substances in this state, and build a future for New Mexico that we all can live into. Thanks for what you're doing. Let's have fun doing this as well. Welcome.
He's taller than I am. Good morning. I'm Mary Jo Daniel. I'm the director of the Faculty Research Development Office, which is a part of the Office of the Vice President for Research. And I want to thank you all for taking the time to be here this morning and express your interest and support and provide input to this process. It's been a very busy 3 months since our launch event in November, where we began this process. Important, thoughtful conversations led to excellent proposals, as President Stokes mentioned, and new collaborations and connections were formed during this process. Each of the selected Grand Challenge teams met this week for 1.5 days. So they got notified, and then we told them they had to meet for a day and a half. And with the support and help of our facilitator, Andy Burnett from KI, or No Innovation, they delved deeper into the problems that were part of their challenge, welcomed new participants, new perspectives, and thought backwards. If we're going to get to that bold, ambitious goal, what are the things that need to happen? Even with our weather-related closure causing a bit of a wrinkle in our plans, I want to acknowledge the resilience, the flexibility, and the commitment of the faculty who said, that's not going to stop us, and we kept the conversations going online. So we got to explore different ways of collaborating virtually, using this as an opportunity to grow those skills. So the work of these teams is just beginning, and they'll present today to you their current vision in a very brief presentation. We're doing this now at the start of their work to provide all members of the community, everybody who's here, as well as those who may be watching the live stream and those who will watch the video recording later, to provide your input, your perspectives on these challenges. On your tables, if you're here in the room, there are some papers that we'll be looking at later, and they have some questions on them that I ask you to consider as you're listening to these presentations. What excites you about each challenge? What additional perspectives might the team consider? Who else should the research team include in their work? And I'm going to invite you, after the presentations, to jot down some notes, and we'll have some conversations at your tables, and we'll collect these and get this information to the teams. And there's an opportunity, if you want to include your name and email, if you want to engage further, you can do so. So each team is going to present for 10 minutes, then we'll have a few minutes for questions and answers, and then after all three have presented, we'll have some time for group discussion. So with that, we're going to get right to it. I want to start with, there he is, Professor Kerry Howe from Civil Construction and Environmental Engineering, and he's going to tell us about the Sustainable Water Resources Grand Challenge.
Okay, can everyone hear me? Okay, so that'll be a little better. That probably wasn't the right button. That one? Okay, we're doing better. And I've just used up 15 seconds of my time. Okay, so I'm going to be talking about sustainable water resources. Water is obviously very important in the state of New Mexico. New Mexico only gets 14 inches of rain a year. Only 4 states get less rain than that. We have the 5th largest land mass of the states, but the lowest amount of surface water available. Water is very important to our climate and our culture and our economy here. Water is part of what makes New Mexico beautiful. It is what causes the flowers on the cactus to bloom in the spring. It's part of our recreational opportunities like fishing or rafting on the Rio Grande. It sustains our culture. It's part of the acequias, it's part of the unique culture of New Mexico. And clearly it's important to our economy. Businesses can't move to this state unless they can be assured that water is available for their business practices. And yet our water is under threat. Our climate is changing. We have to worry about droughts. We have an arid climate, and it's changing, and that arid climate leads to forest fires and dieback of trees. We've got problems with water quality. The Gold King mine spill in the second panel there is a clear indication of how our human impacts affect our water quality. We've got water shortages. The Rio Grande nearly runs dry some years when the droughts are really bad. We've been over-pumping our aquifers, and our surface water supplies are completely allocated. The irrigation sprinkler shown in the 4th panel there is from a center pivot near Portales. The ground levels have been dropping there, and unless we do something about it, that's going to go dry, and we won't be able to have irrigation there anymore. So what do we do about it? What are our next steps? So our approach to the Grand Challenge is to connect the natural landscapes, which are shown on the left side of this slide, and that includes impacts from the climate that I mentioned, and that gets connected to our human landscapes, which are shown on the right part of this slide. And our Grand Challenge will create connections between these. And the connections shown, our approach to the Grand Challenge is shown in the center. And to address these connections between the natural and human landscapes, we need to address and investigate various issues, including cultural diversity, water demands, technology, economics. And we need to do all of this in a framework that includes inclusive public engagement, because the stakeholders who use the water need to be able to provide input on how it needs to be used and where it needs to be used. This is all overlain by a framework of legal and policies, which obviously affects how we use our water. Let me talk a little bit more about our approach to this. The first step is we do need to, very much need to, engage and identify partners and stakeholders. So the questions here are, who are the water users? How do they use the water now? How do they plan to use the water in the future? Without clear input from a whole variety of stakeholders across the state, we really can't even start to approach how to solve our water problems. After identifying and engaging these stakeholders, we need to figure out water needs and availability. So if the availability of water is changing because of our changing climate and because of droughts and things like that, we need to be able to understand how much water is going to be available in the future. And once we understand how much is available, then we can look toward how that should be allocated. After that step, then we can think about technologies to help us address water problems. How can we use brackish water as an alternative water supply? Can we use produced water as an additional water source? Can we develop sensors that detect how much irrigation water plants actually need and then adjust the irrigation to the actual needs of the plants? Can we develop new materials that can cool our buildings without using swamp coolers? Can we treat our municipal wastewater to make it into purified water that we can reuse and recycle within our communities? All of these are opportunities that technology can provide to help us address some of these water challenges. But of course, technology can't solve all the problems. We have to worry about policy as well. Where do we store our water? How do we share shortages when there are droughts? These are all policies that need to be addressed as we think our way through to the future. And of course, interwoven across all of these issues is our inclusive public engagement. We need to weave this through everything we do throughout this whole process to make sure that we understand where the future is headed. If we succeed, what does it look like? What does New Mexico look like? Well, we'll have a thriving economy. Now, obviously, water isn't the only thing that's necessary for a thriving economy, but it is one essential element. Without water, we really can't have a thriving economy. We need that as part of a picture of keeping New Mexico going forward. We'll have healthy landscapes. We'll have fresh water, healthy forests, good recreation, and a beautiful place to live. And of course, solving our water problems helps us maintain vibrant communities. Water has been and will be part of the culture of New Mexico, part of our unique heritage. And without solving these problems, we cannot continue to maintain that unique heritage. So who's involved? Who's going to help solve these problems? Well, as I mentioned, I was the convener of a group, but I was just one small person among a very big group of faculty that came together, several of which are here in this room, and many of which helped put together these slides while I was traveling this week. We've got faculty from community and regional planning, from landscape architecture, from civil and environment, excuse me, civil construction and environmental engineering, the Utton Center, the Water Resources Program. And these are just some of the faculty on campus who were engaged in putting together this proposal. And this is just the beginning. The next steps obviously will engage other people on campus, people from other departments. But we'll also be engaging people from off campus. So the other academic institutions in New Mexico obviously have a stake in water resources, and we will engage any of the academic institutions across the state where we can see opportunities for collaboration. The business community has a stake here as well, and there are opportunities for public-private partnerships. The Rio Grande Waterfront is a good example of how different stakeholders can come together and work together to solve water problems. State and federal agencies also have a stake here as well. So obviously there's a lot of people involved in the state of New Mexico who have an opportunity and the interest to help us solve our water resources problems. And it's our intent as part of this Grand Challenge team to engage all of those stakeholders, wherever they might be, to help us solve these water problems. So, it says "and you," and I'll finish with that. No questions, we're done. We've solved all the problems.
Thank you, Carrie. And it is a very big and diverse team. And as you're pondering and thinking and questions come to mind later, that's where you can start jotting things down on those papers so that we can capture them going forward. Next, we're going to hear from Dr. Janice Knofel from the Department of Neurology to tell us about the Successful Aging Grand Challenge. Janice?
I can switch it over. So I have to tell you, this week has been an exercise in flexibility for us. Our full-day workshop was snowed out on Tuesday, and we ended up doing it virtually, which was really quite an interesting experience. And as I said to our facilitator, Andy, I'm really glad that my computer did not have a camera on it, because distress on my face. So our challenge, if you will, is how do we encourage, how do we manage successful aging? And you probably have heard the term silver tsunami. Who has heard the term silver tsunami? Oh, you're hearing it today, okay? So I hope this projects well. It doesn't really look all that optimistic. Okay. Yeah, actually I had asked for a lapel, but I don't know where our AV guy went to. Thank you. So here are some quotes that I have gotten from the internet, from studied individuals who really prefer that we not use the term silver tsunami. So what does it engender? Basically, it is a metaphor to describe the aging of the population. That's us. And it describes, if you will, somewhat of an apocalyptic imagery of this huge wave of individuals who don't look particularly comfortable I would say. It's inaccurate, and it's damaging perception of older age, isn't it? I mean, who wants to be, in fact, I was looking at this last night, and I said, now, which one am I going to be up there? Am I going to be the one on the top? Am I going to be the one on the bottom? Am I going to be in the wheelchair? Am I going to have a walker? Well, the issue is none of us want to be up there, right? And basically, the silver tsunami term is an example of ageist language. So, silver tsunami, what silver tsunami, right? This is a quote from Bloomberg News. Will the baby boomers ever retire? And I'm going to be in that group, I can tell you. The baby boomers do not show many baby boomers do not show much signs of wanting to actually retire. Or if they want to retire from their current job, it's like, well, what's going to be my next job? What's going to be my job in retirement? I'm sure that you have heard that before. So this is where reality hits, right? Our system of healthcare, education, research, and community engagement must dramatically improve to meet this tsunami of change. And that's what I would prefer to call it, tsunami of change. So here we go. These are the 4 components I've just mentioned. And healthcare, so this is the current situation, and this is why I'm talking about this, because this is what we have to improve. At UNM, sometimes for specialty services, you have to wait for an appointment for about a year. Who knows where you're going to be in a year? Patients are turned away routinely, and what does that do? That actually drops our UNM budget. You know, we actually collect money for the care that we give. By the year 2030, we're going to have 2 times the number of our senior population, and that means at least 2 times the number of the healthcare needs. Education mission, here we are. We're on main campus, we need to talk about this. 40% of your fellow students, our fellow students, are over the age of 21. That's fantastic. There is a definite need there's a need and a demand for lifelong learning. And the campus culture may not necessarily be inclusive for older learners. And then we have the social and the community challenges, if you will. Again, by the year 2030, this is astounding, isn't it? Our population in New Mexico is going to be the 4th oldest in the whole nation. We're actually only 23rd now, but we're going to be rapidly aging over the next, unfortunately, 11 years now. There is a very complex network of social supports. So if you are perhaps aging less than optimally, where do you turn for help? Who can assist you? And it's a very complex, somewhat disjointed network that we have currently. And we know that there are also a number of impoverished elders that is increasing. If you recall, just 10 years ago when we had the big housing bust, a lot of people were caught up in that, but the people most vulnerable were the people already in their 50s. If you lose a lot of your resources at the age of 50, it takes you 10 years to recoup from that. All of a sudden, you're 60 years old. And research, what are we going to do about research? We have a lack of a cohesive research agenda for aging. So we need to turn some attention and some resources towards this. It's somewhat, at this point, nationwide and also throughout the whole world, a very splintered effort. And again, we're waiting. If we wait for cures, we're losing time. We're wasting time. I'm in neurology. I'm at the Memory and Aging Center, and we have people on my doorstep every single day who have new diagnoses of Alzheimer's. We cannot wait for a cure, because it's not coming anytime soon. Okay, so how are we going to change this, right? Well, we have UNM hospitals. That's the clinical arm of the Health Sciences Center, and we are going to be striving for some changes. We have an efficiency expert on our team. We're going to improve our operational effectiveness. We would love to have no waiting for health care. Access is the big issue. We would like to be able to accept all patients in a very timely fashion, and we need to look at prevention through the lifespan, and we're talking infants, children, school systems, et cetera. Educational mission, let's see if we can do some cultural transformation. We need to also do some curriculum and some campus cultural transformation as well. Community, this is the biggest part of where our work is going to be going on, actually. We already have made connections with the senior and the intergenerational centers. We have ongoing collaboration with them that has been going on for more than 20 years now, so we have a presence in the community at the senior centers. There is a lot of community support for community living, and that's going to be one of our major themes. It would be wonderful to be able to work at will, in other words, to have some employment opportunities specifically designed for older workers, and of course, retirement with dignity is also very important. So, last but not least, progress through research. So the subtitle of our challenge is called the compression of disability. So I'd like to just take a second to explain that, and I'm going to use my mouse here. So the green line that you see at the top is successful healthy aging, and you can't really see the ages at the bottom there, but you stay at your tip-top shape in function and cognition until about maybe 85, 90, 95, and then you quickly deteriorate and then end up, as they say, dropping off the cliff. That's what we call optimal aging. So we have 4 projects that we have proposed, and they are listed here. So Healthy Aging Project, Activity Participation Project, Home Alone Project, and Dementia Choices Project. I've got a slide for each of these, and then we will finish with our summary. Okay, so Healthy Aging Project, what's the problem? Half of all 65-year-olds have functional limitations. That means they can't be able to take care of themselves the way they used to 10 and 20 years ago. There are many health challenges that lead to those functional limitations, and most of them are preventable or remediable. So we need to focus on that. The solution, how are we going to address this? So we're going to propose and we're going to execute community-based screening for the domains of function that we have: walking, thinking, emotional, psychological health, physical, and then sensory, which is the vision and the hearing. And the protocol we're going to be using, we're going to be piloting a new project that has just come out from the World Health Organization that includes actual ways to go ahead and check all of these functions in an individual in about 5 minutes. We can get a total snapshot of what their function is. So after we have those results, we're going to write them down. We're going to give a copy to the individual. We're going to encourage them to take them to their healthcare provider and their family. Their family's going to be very interested in this too. And then we will follow up with that at the next visit there at the senior center. Again, this is going on in the senior centers. This is not going on in the hospital or the clinics. This is at the senior centers. And I think that's going to be the key to our success here. Another project that we have in the works is called the Activity Participation Project. The problem is seniors often lack a peer social group with similar interests, and that's very important. If you don't have that kind of outlet activity, it will lead to social isolation, loneliness, depression, and ultimately poor function as you impair your own affect. The solution, during the Healthy Aging Project, we're going to be doing an activity inventory also to see, and as I say to my patients, okay, so I know how you take care of yourself, et cetera, but what do you do for fun? I want to know what you do for fun, because that's the zest in life, if you will. So following the activity inventory, we're going to be able to make suggestions and channel people and to additional activities that are on site there at the senior centers. So we're actually going to be recruiting for more activities there at the senior centers. And not just at the senior centers. How about field trips, dramatic performances, musical performances, adult education, et cetera. And so these results will then be tracked, and we will compare this to their pre-program status. So that's the piece of the research right there. You know, can this intervention really improve things? So next we're assuming a slight decrease, if you will, in the person's level of function. So we call this the Home Alone Project. A lot of older people, a lot of us live alone, period, but a lot of older people are more likely to live alone. Up to 40% of women after the age of 65 live by themselves, 20% of men. Does that mean that the men are smarter and they connect up with somebody? I don't know. I'll let that to your imagination. So living alone will sometimes add to isolation, depression, and anxiety about the future. And this change of it in itself statistically results in increased falls with injury, malnutrition, oh, I just don't feel like cooking today, and avoidable emergencies. So the solution is that once we identify an individual who has needs and is living alone, we're going to activate a team to go in and do a home visit, to do what we call a safety evaluation of the home, to see what additional things that the community can provide that will allow them to function better. So this is multifaceted, and it's going to be a personal assessment of their personal assets, as well as the home environment. The custom intervention is going to be evolved to ensure continued safe and satisfying home living. And we also, the most exciting thing to me about this is the ability to have assistance with internet technology and wearables as per personal preferences. So be able to be more connected, if you will, through the use of technology when they are home alone. And last but not least, this is a project near and dear to my heart. It's called the Dementia Choices Project. The problem is that the majority of people with dementia are living in the community with their families, okay? So that's actually a good thing. The bad thing is that families are not often connected up with the kind of resources that they need. You have to, every person, every family member taking care of a person with dementia has to solve the problem themselves. They have to reinvent the wheel over and over again. Where are the services that will help me take care of my loved one in the home? So the solution, we have a solution. We have professional care managers who can help us. They know the system, and we are going to involve a partnership with the individual with dementia and their family, with the care managers, to improve that navigation to all of those resources. The goal is to allow the person to continue to live at home in a safe and loving, familiar environment, to cut down on any emergency room visits and also hospital visits. And last but not least, to be able to live at home and not have to go to a nursing home. And of course, the burden on the caregiver will also be improved, and that will allow them to be able to continue on their caregiving journey. And so, I tried to put the pictures on the slides, but that didn't work. So here we have the individual living at home. You've got the musical group playing. You've got obviously a learning educational opportunity right there. We have two individuals who are on their own, living by themselves, and then last but not least, we have the woman with dementia who needs a lot of care in her home. So we have tailored interventions for all four of those care opportunities. So here we are. We're logo heavy here at UNM, I understand. So here are some of the people that we're working with, and we also have a wealth of community partners. We have actually a few people here today from the Alzheimer's Association who are in lockstep with this project. We have the New Mexico Department of Aging Long-Term Services, again, a very interested partner, and we've been working on these problems already for a number of years. And of course, AARP, who doesn't know about AARP? They're about independence in the community. And Let us not forget the silver tsunami, but this time we're going to be on top of the wave. We're going to be ahead of the curve for aging in New Mexico. So that's the end of my presentation. I'll be happy to take some questions, some concerns. Thank you. Yes.
Now that we know, we all know that we'll probably live longer than our parents or grandparents. I think we have the responsibility to think ahead about what do we want when we're older, where do we want to live, who do we want as caregivers, and how are we going to pay for it. The previous generations, not understanding they were going to live so long or thinking the only options were nursing homes, dumped the responsibility on their children or the rest of the community unwittingly. So I think we have the obligation to think ahead. Thank you.
Thank you. I could not agree with you more. We have to plan for these things in advance, and although this project is not focused on younger individuals, I mean, we all know that aging starts, 30, 40, 50? We need to be thinking about keeping ourselves and our families in good shape. Sir.
Hello. Hello. I'm Steve Borbas, president of the UNM Retiree Association. And we would like to join you guys very much. I have a number of other people from my board, who are also very interested in this. I'm also involved with the City of Albuquerque Senior Affairs Board. And Anna and I, we've talked about these kind of things, especially in the senior centers. And I think that has a major growth potential in the City of Albuquerque. So thank you for doing this.
Excellent, thank you. I should mention, just one second, that we are so lucky in the City of Albuquerque and Bernalillo County. We have a fantastic network of senior centers. I've never seen such a well-organized and forward-looking group. So we need to build on that also. So that's wonderful. I'm going to give you my card. Thank you. Thank you very much.
And our next and third grand challenge, I'd like to welcome Professor Katie Witkowitz from Psychology and the Center on Alcoholism, Substance Abuse, and Addictions, and Professor Brandy Fink from the Department of Psychiatry and Behavioral Sciences.
Okay, we're going to tag team this. So we're tag teaming this whole project. So I'm Dr. Katie Witkowitz in Psychology and Center on Alcoholism, Substance Abuse, and Addictions.
And I'm Brandy Fink from the Department of Psychiatry and Behavioral Sciences.
Okay. So we are 2 teams brought together. Our total team number is 83 people so far, and we're hoping to build that today. This is just a small representation of the various teams, departments across campus that are represented on our very large team. And so as you can see, many disciplines are represented here. But also, I want to highlight that many community partners throughout the state of New Mexico are involved, and I'll let Brandy say a few words about them.
Yeah. We have community partners literally from every community in the state, and we're also very lucky because we also have the involvement of some policymakers with us, our state epidemiologist, Mike Landon, and the director of the Behavioral Health Services Division, Wayne Lindstrom, as part of our team too. So we feel we can be very effective at moving policy around substance use in the state. And we're passionate about this idea and the problem of substance use because I can guarantee you there is not a single person in this room who has not been affected by a substance use disorder in some way, either personally or a family member or a close person that they care about. Have been affected by substance use. And we see here just in the state of New Mexico that 26% of our residents report having a family member suffering from a drug or alcohol problem. A close friend who's actively using substances or in recovery. 29% of our residents report that. And 33% of our residents know someone who have died from an accidental opioid overdose death. So it's really an area of significant passion for us. We've also seen recently that methamphetamine rates, death rates, have more than doubled in the state from 2013 to 2017. The interesting feature about this is that it tracks heavily with activity in the oil field. So as we see more gas and oil drilling in the state, we see an uptick in our methamphetamine use. We also see that about 90% of drug overdose deaths involved both a benzodiazepine and an opioid in 2017. And 2 of 3 individuals who died from a drug overdose death in New Mexico, those deaths involved an opioid. So I was very passionate about this problem because it's wreaking havoc throughout our communities.
So we hear a lot about the opioid epidemic, and part of our grand challenge, though, is much grander than that. It's a piece of the problem, but New Mexico is impacted in a lot of other ways. We are #1 in the nation for alcohol-related mortality. We have more deaths, more than twice the deaths than the national average. We're #1 in property crime, because the issue with substance use disorders is it's not just the use of a substance. It is pervasive throughout our communities in a lot of different ways. We're #2 for child poverty. When parents are using substances, they have a hard time holding down jobs that can then care for their children. We're #3 for accidental death. We're #4 for suicide mortality, and we're #5 in the nation for births impacted by opioid use. We have major problems in our state related to substance use. That said, our grand challenge is not about the doom and gloom of these statistics. Our grand challenge is about hope and about bringing us up from these statistics and bringing better health to our communities.
And so when we're thinking about GRAND, I also want to let you know that we're thinking not only about time scale, but also about the depth of coordination and integration and interdisciplinary approaches to really reversing course for this. So it's not just, it's going to take us a number of years, but it's going to require an increasingly integrated, coordinated approach to do this at these multiple systems. So needing to intervene in the healthcare system, criminal justice system, our rural and diverse communities, impacting the economy, education system, especially with prevention here in this area, and then, of course, our research and how do we do this in effective and innovative ways. And so one area that I'm quite passionate about, you know, when we think of substance use, we really often think about the individual who's at the very extreme end of the spectrum, who has dependency in things. But we have a whole spectrum of folks that we can prevent from even beginning substance use and identify early. And so we're really passionate about drawing on our diverse communities to find effective solutions to these prevention and early intervention, as well as intervention with folks who are already experiencing dependence. And then really working with our diverse communities to strengthen families and the communities for future generations to come.
So one of the reasons that I came to New Mexico is New Mexico is internationally renowned across the world for treatment of substance use disorder. Many people don't know that here, but people know it in Japan and Denmark and Poland and many places I've given talks. They say, "Oh my gosh, you're at UNM. That's amazing," because of our work here on substance use disorder treatment, prevention, and policy. And so we're going to partner with our rural communities to support all New Mexico residents. This grand challenge was really an amazing opportunity to bring together people from so many different departments and schools and colleges on campus to have a bridge that we haven't had before, to have a way to communicate across campuses, across schools, to do have a multidisciplinary approach. And we're hoping to bridge basic science with applied science, with implementation science to address this critical problem in our state. And you know, a big part of this is external funding and foundation funding and bringing together science with practice, with policy to improve these problems in our state. So what will New Mexico look like when we succeed? Well, the really fun thing about working in substance use disorder and why I love this topic so much, why I'm so passionate about it, is it's like dropping a pebble in a pond. When you can help a person who's struggling with substances recover and have better functioning, it improves beyond that person. It improves their communities, it improves their health, and it improves their family. So we're going to improve health, we're going to increase functioning and quality of life and decrease mortality in the state. We have very ambitious goals about that. We're going to improve our communities. We're going to reduce crime and bring economic development. When someone's using substances, they're not in the workforce as much. We're going to increase workforce productivity and development. And that's going to strengthen families for generations, to foster hope across the lifespan, and of course decrease the disparities that currently exist.
I think that's our grand challenge, and we are happy to take questions or comments from the audience.
So I want to first of all ask you all to help me thank all of our presenters this morning. Not only did they spend a day and a half working together this week, but they had to put together these PowerPoint slides and a presentation and figure out their message. And our last presenters got less than 24 hours to do that. So people have really been committed to this process and really invested their time and energy. So now we're going to turn to you and ask you to think about what you heard and to address both the questions we posed before, but there's also a couple more that talk about how do we engage students in this process? How should we be engaging undergraduates and graduates in these challenges? And how should we better, I mean, all of the presenters talked about engaging communities, and what are the best ways to do that as well? So I'm going to ask you to do a couple things. First, after I stop talking, I'm going to ask you to introduce yourselves at your table. You may well have one or more people from one of these Grand Challenge teams with you, and so you can actually talk to them further about the process and what they've thought about and their plans and where they see this going. After you introduce yourselves, I'd like you to take a few moments to think about those questions that are on those cards that are on your tables. What's exciting about this? Why should we care? What are some next steps that you see for these groups? What might they do that perhaps you didn't hear? It may be they thought about it, but we limited time, but it may be that you've got a really out-of-the-box idea that nobody else has thought about. So I encourage you to jot those ideas, talk to each other about them, and jot some of them down. And then we'll come back in about 15 minutes to see where you're at, okay? So introduce yourselves, and then start talking about those questions on that paper and jot some notes for us.